I think that the essence of value-based healthcare is to be patient-centered. I mean, when we think about value, we think of the change in the outcomes that matter most to patients for the cost of achieving those outcomes. The key element there is that it has to be the outcomes that matter most to patients. And in our approach, we really focus on relationship-centered care, which I think is a little bit broader than just patient-centered care. It fosters and supports the relationships that are central to healthcare, the relationship between clinician and patient, between patients and families, between health systems and the people that they take care of, and really focusing on a relationship-centered orientation, I think makes what we do and how we talk about it different than most of what has come before. But overall, I think it's unquestionably the case that we are, as a culture, as a universe, moving toward focusing on what are the outcomes that matter most to patients, which is a big, big change. I don't think you can do this kind of work without collaborating closely with patients. We take a slightly different orientation than many people. We've developed a research methodology that we call experience groups. And what we do is we gather together a group of people who share a set of medical circumstances. They all have the same stage of breast cancer, or they've all had shoulder surgery, or they have a child with asthma. And we ask them to, for about 90 minutes, speak with each other about what is their experience of living with that health condition. And as we listen to their conversation, what we can understand are what are the gaps in care that are really hard for them, what are the unmet needs that persist, and what are the outcomes that matter most to them. And if you start with that really deep understanding of what matters most to patients, to families, to the people who are living with the condition, and you honor in a profound way their expertise, it changes everything about how you approach the care, about how you design the solutions for them. And I think it's really important in that it honors the expertise of people who are living with conditions. When I start these sessions, I always tell people that each one of you, is the world's leading expert on living with your condition. You know more about it than anybody else does. And will you please share some of that with us so that we can design a health solution that better fits what your needs are? That's, that's patient-centered, that's collaborative, but it's rooted in a different kind of understanding, one that says, you, as the people who live with this condition, are the expert. We need to learn and we need to orient from you. The ICHOM certified high value healthcare professional program is really exciting. It is the first opportunity that we've had to bring experience-based, deeply rooted, deeply researched work in high value healthcare to a very large audience. We've had a program here at the University of Texas for 5 years where we've had 50 or 60 people who go through a year-long program. What we've done is we've been able to pull out the really essential elements of that program into a 5 masterclass program that people can complete in 50 hours. And when they do, they will have a whole new set of skills that show them how to lead transformation to high-value healthcare. What's really different about this is that emphasis on how-to skills. What we know is that there are tens of thousands of people around the world who want to change healthcare. And thankfully, there are 46 really valuable outcome measure sets that ICHOM has created over the past decade. But then they run into a little bit of a problem. They say, well, what do I do? How do I do this? What's the first step? What's the next step that I take? And so we have a case-based program that leads people through a whole series of experiences so that they gain the skills themselves in how to do this. It has asynchronous pieces that people can study and do on their own, and discussions with 35 other people, live Zoom discussions where they go through a case and really put themselves in the shoes of the case protagonist. And we think that combination of deep academic expertise and implementation frameworks and structures combined with discussions that allow people to hear other people's experiences and put themselves in the shoes of successful change agents is really going to be powerful. I think it's really funny that it's 2024 and we're having a debate about what is the appropriate level of decision making for patients when it comes to their care, when it comes to what the health system is. The existential purpose of healthcare is to help people. It's to help them regain their health. And they know more about that, and it is defined by them. So I don't think we can have too high of a level of patient involvement in decision making. I think it just blows my mind, candidly, that it isn't the starting point of everything that we do. There's absolutely a role for expertise in healthcare. I have a physician, I have several, and I'm friends with many, many physicians, and I honor and am awed by their expertise. But there's a difference between expertise and decision making, and ultimately the decisions ought to be made by the people who are receiving care. Oh, I'm really excited about the panel that we're doing. We have been working with a group of parents here in Austin, Texas, for several years now, and that group has been working on its own for years before we got involved. But we've been working with them about what is the appropriate care, what would create solutions for them in the care of their children with medical complexity. So we have on the one hand, I mean, we have really dedicated, wonderful parents who have given a major part of their lives to the care of their children who have medical complexity. But as you listen to them and as you talk with them and watch their interactions, you realize just how impossibly difficult the healthcare system makes their lives. And what we've been able to do is by bringing together a group of these parents and an amazing physician named Rahel Burhani, and people from the payer side. In the US, these children are covered primarily by a state insurance program. So it's very much like a European system where everything is covered. We bring all those people together and get the regulators and the payers and the clinicians really listening to what's important for the parents, what makes things easy for the parents, what makes things really hard for the parents. One of the examples, we have a mom in this group who her child's medical complexity was such that she needed a lot, the child needed a lot of different caregivers, and the system had assigned 8 different care coordinators to one child. And this mother is looking at the situation and saying, it's a full-time job to coordinate the care coordinators. That's a place where we just aren't listening to what people really need. We're not doing the things that matter most to them. And so what people will see in this panel is both the parents who are speaking about what has changed, what they've been able to do, how they've been able to do it. This amazing physician, Dr. Burhani, will talk about how she's brought together the care team to deliver really integrated care for these kids. And we have people from the regulatory payer procurement community who will talk about how they've moved that side of the system as well. And I think it's a great case study in how do you drive change for people with chronic conditions, which that's the name of the game going forward. These children have chronic conditions that are severe and difficult, making this one of the most difficult circumstances to try to fix. But we've made progress in this, and I think it's really instructive for any other kind of chronic care transformation. I'm really excited to be able to announce the ICHOM Certified High Value Healthcare Professional Certificate Program. I think this is going to be an enormous game changer for the high value transformation movement, and it will enable a lot of people to gain skills to really leapfrog the progress that's out there. There hasn't been a program of this caliber available at this scale before. And I think the announcement of it, obviously a little bit leaked now, but I think the announcement of it is going to be really exciting. I think the other thing, I would be totally remiss if I didn't admit this right away, which is I can't wait to see people. The power of the ICHOM conference is unparalleled in its ability to draw in all of my people. I mean, the people that are doing the work that I do, that are thinking about the issues that I think about. And I learned so much by connecting with all of the people who are there. So that's the real draw is the 700 or 800 or 1,000 people who are going to be there. But the education program is kind of my baby, so I'm excited.